Keeping your kids healthy this time of year can be tough. Parents often wonder, when is it time to take their children to see the doctor? We asked a doctor from Overland Park Regional Medical Center's Pediatric Emergency Room. 41 Action News anchor Lindsay Shively has today's Your Health Matters.
Winter weather often means we are indoors and in close quarters, making it easier to spread germs. So a reminder before your holiday get-togethers.
Usually they say about 3 feet is a contagion zone. So if you've got, a 2-year-old kid or, a toddler who's school-aged who is then coming home and kissing on the infant, it's best to keep them separate. So different rooms are at least 3 feet away then.
From sledding mishaps to respiratory infections, pediatric emergency medicine specialist Dr. Adam Gabriel Schiffman says his ER has been busy.
The season is very early, and so even though winter's not here yet, we are feeling it now, and I think we're going to have a very long season of colds and viruses that are going to be here for the duration of the winter months.
Schiffman says he is seeing a lot of cases of RSV, a kind of common cold that can hit the youngest of us the hardest, landing infants in the hospital. We asked what symptoms should alert parents to take their kids to the doctor.
With RSV, especially in the young ones, they may have difficulty breathing. And so if any kid is looking like they're having struggling to breathe, if their respiratory rate is over 60 breaths a minute, and you can tell that if their belly is going faster than their second hand is ticking on their watch, that's too fast. They have any color change, some blue or purple to their face. If they look distressed, those are definitely concerns that they have to be seen emergently.
And we asked what signs of a fever warrant a trip to the doctor for your child.
So there is no too high of a fever because your body's doing it by itself, so that's okay. It's how long the fever goes is more concerning. Most viruses last about 5 to 7 days. So if you're having any fever, whether it be 100.4 or 104 for greater than 5 days, they should be seen by someone in the medical field.
Then sometimes with ice and snow, injuries outdoors need medical treatment too.
Being cautious of the ground underneath you, wearing protective shoes, boots with good tread, kind of salting the drives, all that helps prevent those slips and falls.
But when is it serious enough to seek medical help? Schiffman says parents should trust their gut and don't be afraid to bring them in.
If they think that something is not normal, if something looks more severe than what they're comfortable with, then I'm never going to tell a parent not to come to the emergency department. If they're concerned, they should come. If there's any, in terms of head injuries, if there's any loss of consciousness, not acting appropriately so they have an altered mental state, or if they're having persistent vomiting, all those are concerns for head injury, and those should be seen emergently.
Lindsay Shively, 41 Action News.